Welcome to the Beauty Scientists with Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
In terms of sham surgeries, which we love talking about, I'm sure you've heard of hole punches, and I have not done a lot of research, but it sounds like you've done more about what works or really doesn't work with hole punching.
So this all came to me from patients. So I have patients come in and they would say, well, they come in now we're kind of moving on to minimally invasive options, which is going to be liposuction. And it's a minimally invasive procedure because we're just making small nicks in the skin, but it's very maximally invasive in the sense that we're covering potentially a very large surface area. It could be the whole torso, arms and thighs. Like you can do liposuction all over your entire body. And so it's that's a real surgery, and it's worth doing your research to figure out exactly how it's being done. And how I've seen liposuction presented to patients is particularly in an outpatient setting, meaning they're awake, maybe they're given just a little relaxation medicine or something like that. They're told it will be scalpel free and basically a lunchtime procedure. And I was like, well, gosh, I was like, what is this patient talking about? I was like, you can't get into do liposuction without a scalpel. Like you have to make a little hole. Like you're still getting in there. And so what I found out is, if you have like a mole that needs to be biopsied or something like that, if at your dermatologist, they go and they'll take those little like medical hole punches and punch it out. So they don't use a scalpel. They use one of those. It is still a cut in your skin. And I just think that's incredibly unethical to tell patients that, because it makes it sound like they're not really having surgery. But of course they are.
If you use a skin punch, and then you're making a hole in the skin, and then you're sucking out fat, that's surgery.
That's surgery, and it's liposuction. It's not a lunchtime procedure. And they're also told that they'll be back on their feet and everything's going to be like back to normal within like 2 days or maybe 3, and instant results. And that's all. I mean, if you're having an instant result after liposuction, you didn't do very much.
Right. You maybe didn't need very much, but also how much fat can you extract in a lunch period? Not very much, to be honest.
Yeah. So I think that's one thing. I have tried to do as much awake as possible. And at one point I would do like liposuction of the whole torso, even fat transfer, BBL. I have since stopped doing that. And the reason why was I just found I wanted patients to be more comfortable during the procedure. I think this concept that you can do maximal extraction and still keep patients really comfortable by injecting lidocaine and some other numbing agents. I think you can do improvements. Certainly if it's small areas, maybe just an arm, maybe just a hip, or a little like touch-up session or chin liposuction, small areas. Very reasonable to do it awake or just with like a little relaxation medication so you have a nice experience. Once you're trying to do something that's more involved, one, you can only inject so much numbing fluid in someone safely at a given time. And so you're potentially limiting yourself that way. Number two, you have to inject so much volume to get patients comfortable that it can mask even the surgical result that you're getting. So now if patients want to do more than a small area, I will only do that under general anesthesia, because ultimately patients are there to get a beautiful result and maximum contouring. And I feel like I can best deliver that in the operating room. Have you tried both ways or different ways? What are your thoughts?
It takes a special patient who does not get anxious, and it's definitely a shorter or less amount of fat to be removed. So what Dr. Hamilton's talking about is, yes, we inject numbing medicine into the fat before we do liposuction. We actually do that even if the patient's under general anesthesia. It's called tumescent fluid. So yes, it numbs, but it also slows down bleeding. So that's why it's so important. So if you're awake, my concerns are, it may, just like you said, you may need more numbing medicine, more tumescent fluid, so that you get good numbing relief for the patient. And generically, I think it's hard to sit still for more than an hour or two. I've had like oral surgery where I had to keep my mouth open for an hour and a half and my jaw hurt. And since I'm a doctor, I knew what I was doing. It just was sore and it hurt. And it's hard to sit like on your back in a dental chair for an hour and a half. And I was not in pain. So for liposuction, where you're talking about a consumer and they're not used to what's going on and they're hearing weird noises and they may get anxious and you have to tell them to stay still for an hour or 45 minutes or 2 hours, that's hard. That's hard to do in me. I can't imagine if somebody was not like fully aware of the process.
Yeah, I completely agree. And so I think it comes down to patient experience. It comes down to safety. It comes down to just ensuring that you're delivering the result that you've promised that patient and meeting those expectations. And so that's why I prefer general anesthesia now, which, as we all know, is safer than driving a car around Houston, at least.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.